A big hello to everyone at the Coalition. Apologies I can't be there today for the round table. I'm actually doing some filming with Calm on this day. But I just wanted to send a little message in to say a huge thank you for all your work, everything that you've been doing, and the support that I've received from all of you individually and as a group. And I thought I could just kind of make a few reflections, I guess, or have a few reflections on the members' report. I think it's clear that there's quite a mixed bag in terms of people's experiences and why they've felt that way and the things that have contributed into that. I'm sure we can discuss that at length, but I thought I'd just kind of talk a little bit about what I've been doing over the last couple of months and I guess feed into hopefully that report from that perspective. So I've been doing my mental health tour, so going around the parts of the UK. So I've been up to Scotland a couple of times, been up to the north, so I've been Birmingham's, Liverpool, Cumbria, Manchester, down to the Midlands, down south. I've gone also back to Wales a couple of times as well. I've just tried to get a real feel of experiences of what are people experiences both at schools, colleges, universities, and speaking to individual children with mental health illness and also those who are not suffering any illness, and just getting different kind of perspectives. And yeah, I think it's been clear that those who have underlying mental health illness, particularly those with anxiety, eating disorders, have actually found things worse throughout the pandemic, and actually going back to school has been quite difficult for some, not for others. And I think that kind of really highlights the need and importance to actually support those who already have diagnosis, but also actually being aware that those who might have subclinical issues now might actually be experiencing clinical levels of illness that would be diagnosable and need kind of higher level of support. And I guess that feeds very much into the Fund the Hubs campaign and the importance of those. I think a lot of what I've heard from young people is they want early intervention, they want to be able to access support without waiting times, and they don't want it necessarily to be in a clinical space. And as a lot of you will know, I'm extremely passionate about the Fund the Hubs campaign, working with Young Minds very closely, as well as other members of this coalition on this project. And I've been filming something which might actually be announced by now, which is very exciting and hopefully really going to push for the Fund the Hubs. And it's something I really want to see happening. Young people have asked for it, they've said it works. I've visited several hubs around the UK that already exist based on existing models. And I think if we can actually nationalise that and have a standardised level, I guess, of support of hubs across the country so that every community can actually get the supports they need. I mean, some of the areas I went to had incredibly long waiting times for CAMHS. I think it was 260 days in some places or more, which is quite shocking, even up to a year or so in parts of Scotland. And then children getting there to that point, having that appointment, finding out they're not in the right place or they're not getting the support that they need there. So these hubs are really exciting. I think we really should be pushing so hard for them. So thank you to everyone who's been campaigning, working so hard on this project. And yeah, let's keep pushing. Thank you again to all of you for your hard work. Thank you to the parents and the young people that contributed to this report. It's so important for us to understand and hear from young people. I think that's the whole point of my role, I feel, is to go out there and speak to young people, to listen, to hear, and amplify their voices. And I hope I can continue to do that. Anyway, thanks so much. I've waffled on far too much, and I'm sure you have important things to discuss. Take care, and I hope to see you all very soon.